Palliative care research can considerably improve the patient and family experience, and can benefit from integrating patient engagement into the research process. But how can researchers best do that? This is episode 3 of Pep Talks, the Patient Engagement Podcast. In this episode, I talked to Sadia Ahmed, a master's student in the Department of Community Health Sciences at the University of Calgary. I asked her first to define early palliative care.
First, let me start with palliative care, which is basically an approach to care that aims to improve quality of life for patients and their families who are facing challenges associated with their life-threatening illness. And some of the support that this would mean is treatment of pain or attending to physical, psychosocial, and spiritual needs. So I see palliative care as an added layer of support that can be used alongside cancer treatments.
Okay.
With early palliative care, this is basically implementing that support early on in the care. Shortly after diagnosis, some organizations, such as in Canada, Choosing Wisely, in America, ASCO, they recommend 8 weeks into diagnosis because there's just so many things involved in the patient cancer journey. So they need to understand their illness. They need to be able to cope with their illness. There is talk about advanced care planning and what's their preferred method of decision making, attending to their symptoms, their functional status, and the coordination of care. Those are all elements of palliative care, and that can't be done at a late stage. So that's why early palliative care, it's important to study it, and it's important to implement it earlier on so that patients are receiving that support and that their family members are involved too.
Okay. Yeah. Are there any like misconceptions that people have about what palliative care is?
Oh yes, definitely. So there's still a stigma behind that term with palliative care. With most people, when they hear that term, automatically thinking end of life or death.
Yeah.
And we don't only see this from the patient's perspective as well, but also clinicians. There's just not enough, I guess, education, but also education and being comfortable with that term.
Yeah.
And so what teams are doing now are trying to involve different clinicians, such as nurses, oncologists, family physicians as well, to become comfortable with that term, to understand what supports they can provide for patients, and that it's necessarily end of life or death. It's just supporting patients. So
tell me about how your thesis project then fits into this world, and like what is your project about?
So right now across Canada, there is inconsistencies to how palliative care is delivered. For instance, in Alberta, most people who received it, they tended to receive it late, within the last 3 months of life. And this does have negative implications for the experience for both the patient and caregiver, more emotional distress, and decreased quality of life. And there haven't been many studies actually asking patients and caregivers about their experiences with palliative care. So my project kind of fits in where it's part of a larger initiative at implementing early palliative care pathway for advanced cancer care. And so what this team, the PACES team, is Palliative Care Early and Systematic. They're based in Alberta. They developed this pathway, kind of like a guideline for clinicians to be able to screen patients for palliative care and to be able to understand when to refer patients to palliative care. So this whole guideline, where I come in is basically informing this guideline through interviews with patients and caregivers by first asking them what are their current experiences with advanced cancer. And we focused on specifically advanced colorectal cancer.
Okay.
And I've also interviewed family caregivers as well while they're receiving their cancer care. What are their perceptions of palliative care and other aspects of palliative care, such as advanced care planning? And so this guy, these were 2 sets of interviews that I did. So the first set of interviews was their current experiences to inform this guideline. And then recently in Alberta in January 2019, so it's already been a year actually, the PACES team started implementing this guideline within advanced colorectal cancer.
Okay.
So clinicians, oncologists basically have been utilizing this guideline, same with family physicians, on how to implement early palliative care. And so now that this guideline has been implemented, I've been doing another set of interviews with patients and caregivers also with advanced colorectal cancer to understand what are their current experiences with the initial early palliative care supports that they're receiving. One of them being what are their experiences with they've been assigned early palliative care specialist, so a nurse who's been doing home visits as well as telephone follow-up calls as well to implement the different aspects of early palliative care and really provide a more holistic care than just their treatment or what the oncologist can provide. And so I've been doing these sets of interviews. What I've been doing is interviewing on their care experiences with these with early palliative care, and also whether there are any differences in how they perceive palliative care as well.
So this is a podcast primarily about patient engagement. So do you want to talk a little bit about how you involve patients in your project in any sort of way, and maybe think about what kind of value they might have brought to your project?
So the PACES team that I'm working with, they've been engaging patient partners from the very beginning. And so in the development of the guideline, in all aspects of the guidelines, such as patient education materials for clinicians, such as oncologists and family physicians, these patient partners have been involved in providing feedback, in helping to develop these materials, helping to disseminate information as well. And so that's how I got involved with these patient partners for my specific project and my qualitative interviews. Is since they've already had this expertise in being involved in research and they've been engaged for a number of years, we engage these partners from the start, just as developing the interview guide for patient and caregiver interviews, asking them what are some important questions to ask. Is this the correct way to ask them? How do we go about approaching this question? How do we go about approaching this topic? And so this was one of the main, one of the main ways I engaged them in the very beginning. And then now that we are in the process of putting together findings and in the future looking to disseminate the findings, I'm hoping to involve them in those stages as well, where they can give me feedback on themes as well as the findings and how best to really share this information, whether it's to the public, to other clinicians, to other patients.
Okay. So as a master's student, how have you found the experience of involving patients this way?
I think I've been really lucky because these patient partners have already been working on early palliative care, and this initiative in Alberta to implement early palliative care, they've already been involved in this research. And since I'm working closely with this team, the PACES team, I've been able to connect with these patient partners right away, and they understand the importance of this work. And so it's been really easy for me to be able to connect with them, to maintain contact with them. And I'm hoping to continue involving them in dissemination as well, because there's already been that relationship established with these partners.
Okay. So maybe before this project, think about what drew you to health research in the first place? What was it that made you pick this as a field even?
I think so. Before even coming into university, you don't have any idea of what research is, right? You think of just Googling and then finding out things, putting it together, maybe using Wikipedia as a source.
Yeah.
But so my undergrad was, I think, foundational. It really helped me because I did a research undergrad. I did a thesis in my undergraduate degree as well, and it was in health sciences.
Okay.
So I got lucky with the team that I joined in my undergraduate degree. It really made me interested in pursuing health research, and then I got in touch with my current supervisor as well after graduating. specifically in patient-centered care. And then I think that's where really my passions are in,
Mm-hmm.
is really because it applies to everyone. Everyone benefits from a patient-centered care healthcare system.
Mm-hmm.
And we're all patients, really, right? Like I'm a
Mm-hmm.
patient. I have
Oh yeah, I
family
know.
members who are patients.
Yeah.
We all benefit from having a functioning healthcare system that also is respectful of your needs, respectful of
Mm-hmm.
your wishes, and engages you in shared decision making.
Oh yeah.
So I guess, like, just the idea of really improving our healthcare system. I know I wanted to do something in healthcare. I just didn't want to go into other avenues such as
Mm-hmm.
at school.
Oh yeah. Yeah.
So this was a way for me to like really be part of healthcare research, and I'm really interested in seeing where when evidence becomes practice.
Mm.
So I think with my master's, it's one way where I can see, because the team that I'm working with, they are working so closely with stakeholders, I can definitely see changes being made
Mm-hmm.
um, at different steps, and them involving patients at different steps too. So I would like to continue that forward in future projects that I do, is being able to see changes being implemented with the work, with the collaboration of different stakeholders.
Mm-hmm. No, awesome. Yeah. So let's maybe think about then what you've learned so far about palliative care. So what does that like? What is there anything interesting that you've learned about what it looks like in Alberta and how that maybe compares to other provinces in Canada?
Mm-hmm. I mean, it was interesting to me to find out that so many people are either not receiving palliative care,
Mm.
or that they're receiving it really late in the last end of life.
Mm-hmm.
Like I didn't when I before I came into this project, I didn't realize that there was so much inconsistencies and
Mm-hmm.
across Canada, across uh, developed countries,
Mm-hmm.
in the delivery of palliative care.
Mm-hmm.
And one thing I really found interesting with this work is that to have a dedicated specialist team,
Mm-hmm.
it really helps to really coordinate the care better.
Mm-hmm.
So in Alberta right now, what they're doing is involving a specialist palliative care nurse to engage, to communicate with the oncologist, to communicate with the family physician, and to help patients and families at every whatever support they need, and
Mm-hmm.
especially in talking about their values, talking about what's important to them, affirming death as a natural
Mm-hmm.
process is main thing too. Um, so even with the interviews that I've done, just hearing the different perspectives from people on what's important to them,
Mm-hmm.
and what's in like what palliative care means to them. Right now, I'm also doing a comparison between the early interviews that I did before the
Mm.
implementation of this early palliative care pathway, and now that the interviews I've done with implementing this pathway, I'm able to compare the differences. So the perception of palliative care, that's changed. Care
Yeah.
coordination, people can see that their healthcare providers are talking to each other, that there are different pieces working with each other,
Mm-hmm.
and how they fit in, and they're able to see that they have so much support. And I think that's been really, really interesting to learn about
Mm.
from the
Yeah.
patient perspective.
Hmm. So thinking of the future then. So what are some next steps that you can see that would need to happen to better engage patients and families in palliative care and palliative care research?
Mm-hmm. One thing that came up in the interviews, and I think that's really important, is having a patient advocate or a patient navigator.
Mm.
Um, so not every family will have like their family members there.
Mm-hmm.
Not every patient, I think, will have their family members there to help support them,
Mm-hmm.
and not everyone can say advocate for their care. But
Mm-hmm.
having that extra support there to help guide their decisions, to help not to help them really navigate the healthcare system, is needed in cancer care, and that can aid in palliative care as well.
Okay.
um, and I think patients and caregivers just need to be engaged in all aspects, whether it's care coordination, advanced care planning. They need to feel like they're part of the team. They need to feel like their decisions, that their perspectives are valued and taken into account when planning care.
Mm. So in an ideal world, then 10 years from now, what would you say that patient-oriented research would look like if it was going really well? Like, then what do we have to do now to make sure that we get there?
Yeah. So I think with the definition of patient-oriented research, there's engaging patient partners, there is focusing on patient-identified priorities in order to improve patient outcomes, partnering with stakeholders, and aiming to apply that knowledge into practice. So I think that's what I see ideally. I don't know if every project does that, but I think we do have we have so many different projects across the province in Canada who are aiming to do that. And ideally, in the future, patient-oriented research will just be research. It'll just be seen as, okay, this is something that you need. You need to take into account, is this something that's important to patient? Is it something that's relevant to patients? Are you involving them from the very beginning rather than thinking of them as an afterthought, when you're already, say, deep into your analysis, and then you think, okay, maybe I should have involved patients. Yeah. So moving away from that, I think guidelines would also help. Like, I know I think there's just some inconsistencies still in how people envision patient-oriented research or partnering with patients and families, that there's just not enough information out there or guidelines out there to really guide, say, trainees even, right? So trainees starting their master's or PhD projects. So guidelines to help them to help them structure, to organize a patient-oriented research project would be great. There's other different aspects too, like how do you find representative patients? And because a lot of the times those who are involved in research projects, they tend to be from professional backgrounds. And I don't know, in an ideal world, you would see that there would be an easier way to connect with those hard to reach populations so that you're able to really involve those people and involve those people and identify important research priorities that you may not if you're only solely focused on patient partners who are already been doing research for so long. I think those are some different things I think that need to be thought about, and I think they are. I think people are thinking about them. Like, there are guidelines being developed, and I think it's just later on in the future, I think it'll be common practice. And you'll see more people using these guidelines. You'll see more people having consensus on guidelines or sharing what they're already doing and learning from it.
So maybe one final question. Let's say I was a new master's student coming in, starting my thesis project, and I wanted to engage patient partners. What's one piece of advice you would give me?
Work with a supervisor who is willing to engage with patient partners. So really have that relationship with that. Really have a good relationship with your supervisor, or find a supervisor who you can have an open conversation with. Like, if you notice in your project, like, this is where you think patients can be involved, or even in identifying where to start, you think, okay, this is something that we need to involve patients in. And if your supervisor is not open to that, then what can you do as like a student? So you really need to have that open channel with your supervisor. And I was lucky that I had that, and that my supervisor knew right away, okay, yeah, this is this is what we need to do, and we need to engage patients at this stage, and this is how you're going to connect with patient partners. So as a master's student, I think you need to have that supervisor and team support.
Well, thanks so much for joining us today.
Oh, no worries. Yeah, thank you for having me.
Thanks so much for joining us for episode 3 of Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Strategy for Patient-Oriented Research Patient Engagement Platform. Special thanks to Sandra Zielinski for coordinating guest appearances, and to Brian Steele for his co-production. Make sure to subscribe to this podcast wherever you found it, and we hope you'll join us again for more interesting discussions about patient engagement in health research and healthcare.